Hello, I am Dr. Thakkedath Matthew. Today, I am discussing a very interesting and important subject of sudden cardiac death in young adults. Sudden cardiac death was considered to be a disease in the 60s, 70s, and 40s. However, over the past 20 years or so, more and more sudden cardiac deaths are seen in young adults in their 40s, 30s, 20s, and even teens. And in South India, there is a phenomenon called Adipoli syndrome, and this Adipoli syndrome has something to do with the increased incidence of sudden cardiac death in young adults. Let us start. Cardiac arrest used to be a disease of the 5th, 6th, and 7th decades. Over the past 10 or so years, we see more in the 40s, 30s, and 20s. COVID is blamed to be a factor. COVID is a factor. It produces universal vasculitis. Let me run through the common causes of sudden cardiac death in young adults. Coronary artery disease, hypertrophic cardiomyopathy, dilated cardiomyopathy, anomalous origin of coronary arteries, arrhythmogenic right ventricular dysplasia, prolonged QT, Brugada, and commercial cordis. Let me explain what commercial cordis is. Commercial cordis is sudden cardiac death happening in baseball fields and some football fields. When a baseball is hitting on the heart at high speed, and if the hit is landing on a special junction of the cardiac cycle, the heart rhythm can go into ventricular fibrillation and the person can die. On an EKG, that particular delicate area is 30 milliseconds before the peak of the T wave. Now, a quick trip to the medical school. Coronary arteries supplies the heart muscle. There is a large left coronary artery and a smaller right coronary artery. This is the picture schematics of a heart. This is the coronary artery. The coronary artery is like sitting like a crown on the heart muscle. Therefore, it is called coronary arteries. On a diagram, it will look like this. Right coronary artery with some buildup of cholesterol, left coronary artery with buildup of cholesterol. When you do an angiogram, this is the left coronary artery, left main and LAD, and this is the right coronary artery. Just for discussion's sake, I put a thrombus here in a patient with a heart attack, and I will put a stent. I will show you. This is a stent which is a metallic mesh mounted on a balloon that can be put inside the artery. When the balloon is inflated, the stent will scaffold and the lesion will disappear as seen in the angiogram here. Sudden cardiac death. It is the unexpected abrupt cessation of cardiac function, typically due to ventricular fibrillation. I need to explain what ventricular fibrillation is. Normal sinus rhythm is tedum, tedum, tedum. When in the beginning of a heart attack, it can go into ventricular fibrillation, then it will switch into tedum, tedum, kata, 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 kata. When ventricular fibrillation ensues, there must be defibrillation, otherwise, the patient is sure to die. Defibrillation is accomplished by this little machine, AED, automated external defibrillator. This machine can discharge 120 to 360 joules of current biphasic into the patient's chest that will produce sudden cessation of the heart and then regain of the cardiac system. Let me animate that for you. Tiddum, tiddum, that is the normal rhythm. Then that will go into ventricular fibrillation, then a defibrillation, and then regaining of the rhythm. All of them I will animate for you. Tiddum, 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 tiddum. So that ventricular fibrillation is defibrillated will ensuing normal sinus rhythm. Back, this is the AED. If the brain is devoid of blood supply for 5 or more minutes, it will result in permanent brain death. When you see a patient fainting, you must shout, cough, 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 call for CPR, start defibrillation, call ambulance, cough, cough, cough. What is this cough doing? This is a very interesting graph. This is a patient. I am doing an angiogram. The patient developed a vasovagal attack. The blood pressure dropped from 160 to 100. I am calling cough, 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 cough. See what cough does? Cough increases the blood pressure. This is called internal CPR. And this can go for 5, 6, or even 10 minutes, so long as the patient is conscious. You shout and the patient will repeat cough, cough, etc. Now, this is a diagram of the coronary artery. This is the lumen. Blood is flowing from here to here. This is the endothelium, where there is very significant physiological factors. This is a section of a coronary artery. This is the endothelium. This is the intima and media. This is the adventitia. This endothelium is capable of liberating two enzymes. One is nitric oxide, which produces vasodilatation and prevent the entry of cholesterol into the intima. The other one is endothelin, which is a very potent vasoconstrictor agent. Endothelin function, nitric oxide release, endothelium function, nitric oxide release, and endothelin release. There are stress hormones you should know. The stress hormones are cortisol, adrenaline, noradrenaline. Likewise, there are happy hormones, happy or euphoric hormones, dopamine, serotonin, oxytocin, and endorphins. And then there is sudden cardiac death. There are many intriguing reports about sudden cardiac death in very young adults in Kerala, Tamil Nadu, Karnataka, and Andhra Pradesh. Now, there is an autopsy study, one and only one study from a small medical school, Mancheri. The final year medical students selected 9 subjects aged between 18 and 36 who came to their hospital and died suddenly. They did postmortem examination. The postmortem examination showed no coronary artery disease. All had massive amount of undigested fatty food, all involved in weakened Adipoli syndrome. All involved in weakened Adipoli syndrome. What is Adipoli syndrome? Adipoli syndrome is a revelry at the weekend involving smoking, drugs, alcohol, and large amount of food. COVID is believed to be a reason. COVID, of course, is a reason. It produces vasculitis, endothelialitis, and it releases nitric oxide, releases endothelium. But we had COVID only since 2020. Adipoli means smite and demolish is a trend among affluent youngsters, particularly in developing countries like India, involving wild revelries with indulgences in smoking, cocaine, fentanyl, heavy alcohol, and massive amounts of junk food. There is a huge bulk of young professionals, very highly educated, all of them in IT industry, most of them doing work from overseas, outsourcing works. They get massive amount of money. They work extremely hard from morning on Monday to evening on Saturday, and on Saturday evenings they get together to break it loose. It is called Adipoli syndrome. Adipoli syndrome has quadruple jeopardy. It involves cigarette smoking. It may involve cocaine and fentanyl. It always involves large amount of alcohol and massive amounts of junk food. massive amounts of junk food. This massive amount of junk food is very important. Alcohol, small amounts, 1 to 2 drinks, releases the happy hormones, produces euphoria and nitric oxide release. That's the reason why you will see people with red face talking, singing, and being and behaving very happy. But when the drinks are 4, 6, 8, etc., they develop shit face, and the stress hormones are released, and the endothelial dysfunction happens. Now, cocaine and fentanyl, in very small doses, it produces release of the happy hormone. In large amount, it produces stress hormone, produces thrombosis in the coronary arteries, producing heart attack and death. Large amount of junk food is very important. Gastric dilatation, increase in blood supply by 250%, relative ischemia to the heart, disruption to the circadian rhythm. There is no limit a man can eat. You have seen in many reports eating competition where a man can eat 100 hot dogs, 120 hamburgers, etc. The gastrointestinal system is the largest system in the body. Empty, it's 15 pounds. It needs about 5 times the blood supply of the heart. So, at night, there is the circadian rhythm. During daytime, our hormones are active and high. At night time, it is supposed to rest. The brain will require rest for 6 or 8 hours of sleep. All the systems in the body relax. The cardiovascular system relax by reducing its heart rate and blood pressure, and the gastrointestinal system also must relax. That is the reason why in Arsha Bharata, the Maharshis used to say, take the meal at 6 o'clock in the evening, nothing thereafter. So, when you eat large amount of food at night, the heart is responsible for providing large amount of blood to the stomach. So, there is a relative steal of blood from the different parts that produces ischemia, lack of oxygen, and cardiac arrest. Now, Adipoli syndrome. I am asking, is it time to consider Adipoli syndrome a novel risk factor for sudden cardiac death in young adults? In South India, particularly in the 4 states I mentioned, Adipoli syndrome is common. There is much increase in the death of youngsters. That one little study from Mancheri Medical School is very important, and it is the tip of the iceberg. This massive amount of food in the stomach and the relative ischemia to the heart is a factor in those sudden cardiac deaths. Thank you for listening.